Good morning. It's a pleasure to welcome you this morning to our annual HIDA Prevention Summit, part of a month of programming at the Office of National Drug Control Policy commemorating October as National Substance Use Prevention Month. My name is Shannon Kelly, and I am the director of the National High Intensity Drug Trafficking Areas Program, known as HIDA. The HIDA program was created by Congress in 1988 and now has a presence in all 50 states, Puerto Rico, the U.S. Virgin Islands, and the District of Columbia. We coordinate law enforcement efforts at all levels, federal, state, local, and tribal, to make our communities safer by reducing drug trafficking and production. HIDA's mission is law enforcement, but we accomplish that mission by investing in partnerships. Over the past decade, that investment has increasingly taken the shape of collaboration with public health partners. While this may surprise some people who think we're only focused on arresting drug traffickers, for those of us in the HIDA program, this partnership has been a natural outgrowth of our desire to reduce drug use and its consequences across the United States. Advancing prevention at the community level requires an in-depth understanding of the opportunities created through public health and public safety collaborations. We partner with public health agencies and prevention experts because we share a goal and a mission. We all want America's citizens to be healthy and our communities to be safe. Today, we will showcase the fine work being done at the national and regional level through the HIDA program and our many valued prevention partners. This summit also represents an opportunity for all of us to decide where to go next. Today's presentations will help inform all of us as we decide what approaches to invest in and what goals to set. Before I turn the microphone over to our HIDA Deputy Director, Jamie Delano, I want to thank her and our whole team of HIDA prevention experts for coordinating today's summit and gathering all the experts to help us think about ways to approach prevention for maximum impact. I hope you all find today's summit informative, thought-provoking, and energizing. Thank you for your work to prevent drug use, and thank you for your partnership.
Thank you all for participating in today's annual HIDA Prevention Summit. We are pleased you can all join us today virtually. The HIDA program has been extremely successful in achieving substantial impact on reducing the supply and demand of substances in our communities nationwide. Over the last few years, we have worked diligently to engage our public health sector partners to enhance our efforts, and we have paid special attention to preventing substance use in HIDA communities. One component of the HIDA public safety and public health framework is the HIDA prevention strategy that promotes and supports the integration of evidence-based and evidence-informed strategies to prevent and reduce substance use in our nation's communities. The HIDA prevention strategy functions as a catalyst for the development, implementation, and evaluation of prevention programming unique to the needs of HIDA communities. The strategy promotes the establishment of prevention strategies in all HIDA regions using the best available evidence to address the top priority needs with the HIDA. One resource funded to support prevention strategy is ADAPT, which serves as training and technical assistant provider to support all HIDA programs' substance use prevention efforts. ONDCP and the National HIDA program are pleased to host the 6th annual HIDA Prevention Summit. Thanks again for joining us. And now I would like to introduce Tom Carr, the Executive Director of the Washington-Baltimore HIDA, to speak about the value of the information that will be shared with you today to support your many individual and unique prevention efforts in your communities. Throughout his career, Director Carr has designed and implemented more than 150 drug task forces, 18 treatment and criminal justice, and 5 prevention initiatives. Please welcome Director Carr.
Thank you, Jamie, and good morning and welcome, everyone. Before I start my remarks, I want to first thank Dr. Gupta for pushing the prevention program across the nation. And I also want to thank Shannon Kelly and Jamie Delano for making sure that they funded prevention within the HIDA program. The Washington Baltimore HIDA has been involved in prevention since our designation in 1994. We absolutely recognize the importance of prevention in preventing or in stopping the onset of substance use across our region. We also recognize that prevention multifaceted strategies are necessary. And that's why we develop models to bring together a variety of evidence-based programs to protect our communities. You might ask, why is this so important? It's because the world of drug trafficking is changing, and it's changing rapidly. One look at HIDA's performance management system and the drug seizures recorded in there, and you'll quickly see that fentanyl powder overtook heroin as the #1 opioid problem across the nation. More recently, fentanyl pills replaced fentanyl powder, and it's just overwhelmed the marketplace. The world of drug trafficking is changing again, and it's changing rapidly, and we have to be ready for it. Now more than ever, it's important to invest our money wisely to make sure that we're not only we lay a strong foundation for prevention, but also allow for adaptations that are bound to take place. My thanks to the speakers and to all of you for joining us today. I especially want to acknowledge the great work of our ADAPT team and all they've done to put this event together. And now it's my pleasure to introduce the amazing Dr. Laura Papard, who is the director of ADAPT and is also the deputy director for Washington Baltimore HIDA's treatment and prevention program. Come on up here, Laura. Thank you.
Thank you, Tom. He always likes to embarrass me right before I start any big event like this. Welcome back, everybody. Welcome. This is our 6th annual HIDA Prevention Summit, and we are so glad to have you here and joining us today. Seems like we're going to cover this entire summit in thank yous. And I also would like to thank Dr. Gupta, ONDCP, Shannon Kelly with the National HIDA Program, Jamie Delano with the National HIDA Program, for hosting us, and honestly for the funds to support the delivery of this summit to you at no cost. This is it's a virtual summit, and it's being made available to you with the funds coming out of the National HIDA Program. I also would like to thank Fred Dubon and our Zoom events team. And of course, a special thank you to our ADAPT team, who are all sitting here with us. We're a small but mighty group, and we're all here today to deliver the summit to you. So thank you to them. Jamie gave a really nice history of ADAPT and how we came to be, our genesis, what we are grounded in related to the HIDA prevention strategy, and basically how we've been tasked to operationalize this strategy with a small but mighty bucket of money to really work intimately with our HIDAs and our HIDA communities in supporting that integration of the best available evidence. So what you'll see up here on the screen is our mission. And I want you to take a look at that first line: to advance knowledge, skills, and quality outcomes. That's how we have been tasked. That's what we've been charged with. And that is what you have experienced us doing over the last 4 years as we have tried to bring this Training and Technical Assistance Division to life in a way that makes sense for our HIDA communities, considering the current science that we have available to us. The way that we bring our mission to life is through training and technical assistance, and that means something different to everybody. But in this case, what you'll see here at the end of our primary goal is it's the identification, the implementation, and evaluation of substance use prevention strategies. And we've put together this nice pyramid to really explain to you the different levels of technical assistance, so you get to know us better as well as a TTA provider. I'm going to start at the top here at the tailored level. At the tailored level, this is when we are working with our HIDA directors, their deputies, our HIDA prevention representatives, any funded program by HIDA, any specific initiative in a HIDA community that has requested assistance through the HIDA. That's that more intimate involvement and participation with them. But then when we move to the next level of targeted technical assistance, that's when you'll see more of a group effort. This is when we bring in various events and interventions such as learning communities, to really promote and develop a concept such as evaluation. We hosted an evaluation learning community for many of our HIDAs last year. So that's an example of more of a group level targeted intervention. But then when we get down to the bottom here at the universal level, and this is really important for you all to understand, all of these services are publicly available. All of the tools and the products that are created here with the ADAPT team and all of our partners, those are available to you publicly. And that's really important to the HIDA program, that they make as much as possible available to you. So there are over 1,400 of you today, and the HIDA Prevention Summit is one of our most loved, and I have to say one of our most exciting events of the year. It's our biggest event that we host and one of our favorite universal interventions for technical assistance. So welcome to all of you, and I hope this gives you a better understanding of our different levels of TA. You know me by now. I've looked at the list. I know that many of you have attended summit after summit, and you know we are going to ground in a purpose for today's summit. And so let's go through that very quickly. We want to address the complex prevention issues of today. And the reason that we're doing that is because you're bringing us complex technical assistance requests. And we understand, just like Tom mentioned, the changing nature of the substances that are out there, the changing delivery methods, the changing access to those substances, the way that those substances are being made. And so all of those characteristics inform why we are offering and addressing a complex prevention issues today, the complex prevention issues of today. But I want you to pay attention to this second part, because while we want to really tune into the complexities, we also want to tune into whatever we're doing related to that. We want to focus on integrating those activities into a comprehensive strategy. More on that in a second. I think it's really important for you all to understand what informs the theme for today, what informs the future support that we'll be delivering to you after we expose you to the material today. And so there are 3 balls you see here that really inform what we do. And first and foremost, it's the technical assistance request coming from you. You informant, all of you in the HIDA community. 66% of our population lives in a HIDA community. All of you inform what we do because you're bringing your questions to us. We've completed over 330 technical assistance requests as of today. And so we have a pretty good idea of what you're struggling with. Those technical assistance requests come in from across the nation. And what a joy and an honor it is to work with you and for you to share that information with us. Beyond what we hear from you and discover with you, we also look to the literature. We are grounded as translators of the science in the science. So we have to understand what is already available to us. That means going out and finding it, but more importantly, synthesizing it and appraising it for its merit, right? And what we should consider and what we shouldn't, what we should bring forward to you and what we shouldn't. So that's one of our second sources of information. And then the third are our HIDAs and our prevention partners. So we actively partner and consult with numerous agencies, including the National Prevention Science Coalition, Applied Prevention Science International, Blueprints for Healthy Youth Development, the Pacific Institute for Research and Evaluation, and many more. And all of these partners, and I call them our trusted partners because we all sit together on many of these products and on many of these themes and figure out what's going to be the best way forward for you. So those 3 information sources inform the summit. And then you'll see at the end of the summit, some of the activities that will be occurring post-summit to support you in bringing this information to life. So the speakers that we've brought to you today are very intentional. We are trying to share with you various perspectives from the international level, the national level, state level, and local level. And you'll see that reflected in our selection of speakers today. Man, are they good. We've seen their slides. We know what you're about to experience, and we are so excited for you to hear this content and for you to chew on it a little bit and figure out how it's going to make sense for your prevention work. That said, beyond just the various perspectives that are going to inform, right, the complex prevention issues and how we might address those, we also have heard our communities loud and clear in that they're starting to ask, all right, some of this stuff is different, right? We've got different fundamental characteristics that are present now in these substances. How can we make sure that in what we're doing no harm? Unintentionally, but we're doing no harm. And that has been a phrase, do no harm, that we've heard loud and clear from you. And so that is the second piece of our summit today, is really leaning into that and helping you think through how you might do no harm when sharing substance related information. And so what I'd like to share beyond our main message is that we're being very transparent. Very transparent. These are complex issues. This is the best available evidence, but all the answers aren't there yet. The solutions haven't been fully formed yet for some of these unique elements. And so I mean it when I say it's an honor to kind of go on this journey with you, and every day to wake up and put the pieces together and offer you the best we can, right, from what's available to us today. That's what I mean when I say transparency, because we are adapting with you, we are building with you, and we are growing with you over the course of the next few years as we continue to unfold and learn more about these substances. Look at our main message here. Any prevention intervention addressing current or new substances should be, number one, grounded in a comprehensive prevention strategy. We have a tool for you related to this. And number two, thoughtfully developed and evaluated using the best available evidence to prevent unintended harm. And guess what? We've got a tool for you on that too. So what you'll see here are the titles of our two tools that we'll be releasing today. And this is kind of just, it's evolved and it's become a thing, right, that we offer at each summit, because we want to equip you with the knowledge, skills, and abilities to go forth and do great things with this information. And so these are our starting points to thinking through these. Now, I must say that developing a comprehensive community-based strategy is much more developed. We know a lot about that, right? We've consulted, you'll see multiple authors on that document, multiple organizations. So it's solid, right? And our next tool, the sharing substance-related information, well, there are a lot of experts that have informed development of that, and it may not be perfect, but it's the best that we've got right now, considering the evidence available to us. So it's our starting point, and we don't want to hold it up. We want to release it to you now, and it will be a living document, and both of these will be on our website, and you will receive links to them today. So we want you to get to know us a little bit better too. Many of you don't even know what HIDTA stands for, the HIDTA, but you do now, right? High intensity drug trafficking area. And so we thought one neat way of doing this is every speaker that you'll hear today, besides our morning keynote, right? Every speaker that you hear today will be introduced by a HIDTA director. So we have 5 different HIDTA directors from across the United States that will be introducing our speakers, but also sharing a little bit about their approach to prevention in their HIDTA region. So you'll get to see their faces, you'll get to know them a little better, and you can always reach out. You'll see a question on your evaluation at the very end. You can always reach out if you'd like to get connected directly with your HIDTA. But also we have a special treat, 2 special guests, Eliza and Therese, if you'll come up very quickly. Yeah, we've got 2 special guests. This is the first time ever that we have invited people into this space with us behind the scenes with ADAPT as we offer the HIDTA Prevention Summit. And I want you to get to know them as well. Many HIDTAs will fund a formal HIDTA prevention coordinator, manager, or representative of some sort. I've got 2 here with us today. They're kind of learning the ropes with ADAPT. Come on up. Eliza Powell is the first one we've invited. She'll introduce herself briefly.
Thank you so much, Laura, and good morning. It's wonderful to be here. Like Laura said, my name is Eliza Powell. I am the Prevention and Treatment Manager at Northwest HIDA, which is located in the state of Washington. And I've been in this role for about 2 years now. I love it. I love the role. I love, more importantly, the mission of the HIDA program and of the Prevention and Treatment section of the HIDA program. Prior to joining HIDA, I worked both on the data and epidemiology side of things, and I also spent some time working to connect people with substance use disorder to support networks. And so seeing both sides of this has made me very cognizant that data and research and science have a very real and concrete human impact. And this is a major priority at Northwest HIDA. This mission of using information sharing and existing research and evaluation data, all of those things to enhance our impact in substance use prevention and treatment. So thank you so much for having me today. I'm looking forward to an incredible day and an informative day. So thank you.
Thank you, Eliza. You may see her pop on and off. We're not sure. We're going to see how the day goes. Different ways that we can integrate them in this experience. And Therese, go ahead and introduce yourself.
Good morning, everyone. I am Therese Hunter. I am the Prevention Program Coordinator for Liberty Mid-Atlantic HIDA, which is based out of Philadelphia. However, we cover 12 counties between Philadelphia, New Jersey, and Delaware. I'm the primary point of contact there. My background is in 22 years of child welfare working for the city of Philadelphia, as well as I've worked in dual diagnosis with adults and with youth. So it is a pleasure to be here today, everyone. And I'm hoping to be able to be an asset and contribute to this training today. Thank you.
Thank you, Therese. Thank you. So we're happy to have them with us. Now I'm going to do what I have to do just to give you some housekeeping tips. All right. So many of you, the majority of you actually, are coming back. So you're kind of familiar with our Zoom events platform. You've joined through a lobby and you have accessed this session through that lobby. That's how it will be for every other session. So once we conclude here with the housekeeping, then we are going to move over to our next session that you will find in the lobby for our morning keynote. After Dr. Gupta, our ONDCP director, gives his remarks. The public chat has been disabled. However, you have a Q&A box available to you. Use that box, send us your questions. We'll be moderating various Q&A after every speaker. So I look forward to receiving your questions and bringing them forward to our speakers. Various handouts will be uploaded throughout the day, so you'll have access to those beginning with the morning keynote. Those include a housekeeping handout, our resource supplement for each individual session, as well as one that will be emailed to you in its entirety once the summit has concluded. The tools, the tools themselves will also be uploaded, a link to those throughout the day. So just be mindful of that, and those will occur in each session, so they'll be at the top of your box. Navigating your screen, we have talked about just, again, make sure that while the ADAPT team is fully available to you on chat, we're the only people available to you on chat. So please use the Q&A. The evaluations are session specific. So if you would like continuing education credits, or if you'd like a certificate of participation, you'll need to complete those evaluations. That's how we consider who needs the actual certificates at the end. So please complete the evaluations and help inform the next summit and other activities that we engage in. All right, I believe I've covered all the housekeeping items. This time I will hand it over to Jamie to introduce Dr. Gupta.
Great. Thank you so much, Laura. Now it is my distinct pleasure to introduce Dr. Rahul Gupta, Director of the Office of National Drug Control Policy and a champion of the HIDA program in all of your efforts to combat drug trafficking and safeguard our nation's communities from the negative consequences of illicit drug use. Dr. Gupta is the first physician to lead this office. He has previously served in leadership roles at the local and state levels in West Virginia, where he worked closely with the Appalachia HIDA to reduce overdose in the state. He's a champion for the HIDA program, and it is work to bring drug traffickers to justice, and make sure people with addiction get the help they need. Please welcome Dr. Gupta.
And we know that because there's so much that goes into advancing this mission, whether we're talking about work on the ground, domestic and international interdiction, or getting right policies in place to support this work, including funding from Congress. Now, this multifaceted work is critical because of the enormous complexity of the challenge that we're facing. And there's no sugarcoating it. This is a real challenge. An American dies from drug overdose every 5 minutes of every hour, every day of the year. And 3 out of 4 of these deaths involve opioids, mostly fentanyl. That's 110,000 people every year, and 110,000 empty seats at dinner tables across America. If that doesn't break your heart, I don't know what will. This issue is personal to the president, and it's personal to me, and it's personal to all of you as well. But just like you all understand the challenge we face, you also understand a fundamental truth about the solutions, that no one of us can do it alone. We need to build a relationship with unlikely partners. This is a lesson I learned in West Virginia and Alabama and in Illinois, first as a practicing physician and then as a commissioner of public health. I knew that many interventions could save a patient's life in the moment, but that helping them towards recovery was a community-wide endeavor. As Commissioner of Public Health, I knew that there were public health tools at my disposal to save lives, but I needed the help of law enforcement and educators and parents to build a healthier community. So now, as Director of National Drug Control Policy, I know that to defeat the overdose epidemic, we need public health and public safety working together. This is why I call the HIDA program a model for our nation. HIDAs bring together federal, state, local, tribal law enforcement to stop illicit fentanyl and other substances from reaching our communities. But you know what? They do more than just that. HIDAs are the hubs of innovation and partnership with public health. HIDAs are helping local public health entities pioneer overdose SWAT efforts, like rapid response teams. And ADAPT is helping HIDAs and local public health partners develop evidence-based prevention efforts. And as of this year, I have designated additional dollars to targeted pilot prevention activities in key HIDAs. The Biden-Harris administration is investing in HIDAs because you all understand something crucially important. That to solve this crisis, we can't focus just on supply or just on demand. We gotta do both, because we cannot treat dead people. And that's why President Biden has made ending the opioid crisis one of the 4 parts of his unity agenda. Addressing addiction and mental health to save American lives is something that we can all come together to fix. You know, it's common sense. And that's why the President's National Drug Control Strategy is going after 2 key drivers of the opioid crisis: untreated addiction and the drug trafficking profits that fuel it. They really are 2 sides of the same coin. And we're taking unprecedented actions to address both. In order to tackle untreated addiction, we're focused on the entire continuum of care. This is the first administration to openly embrace harm reduction, because we know that dead people cannot achieve recovery. That means that we're focused on evidence-based approaches such as naloxone, syringe service programs, and drug testing strips. So under my leadership, we're laser focused on ensuring that naloxone is present at the scene of every overdose. And today, naloxone is available over the counter. States have received historic resources, to purchase naloxone. In fact, nearly 9 million doses of federally funded naloxone have prevented more than 500,000 overdose deaths last year. Can you believe that? 500,000 overdose deaths. And the federal government is working hand in glove to ensure states use these resources to provide free naloxone to high-risk communities. We're flooding the zone to ensure more people stay alive long enough to seek treatment. And this administration is also focused on improving treatment by meeting people where they are. Now, this starts with President Biden's signature on legislation that did away with the X waiver. With his pen, he expanded the field of buprenorphine providers from less than 150,000 to nearly 2 million. We're also supporting recovery like never before and providing tools for employers to build recovery-ready workplaces. And we're preventing drug use before it begins because we know that this is a highly toxic drug supply where any illicit drug use is dangerous. And so together with Ad Council, we've launched a social media campaign that's educating youth about the dangers of illicit fentanyl and the life-saving power of naloxone. Now, this campaign has reached more than 1 billion impressions. And youth interacting with it are more likely to talk with their friends and family about the dangers of fentanyl than those who don't. realdealonfentanyl.com. What's more, that they are equipped through this campaign with tools to help their friends struggling with drug use survive. Now, our Drug-Free Communities program is celebrating 25 years of success in reducing youth substance use. And we're now funding more than 750 drug-free community coalitions across all 50 states. We're also working with the Department of Education to provide new tools to educators to prevent overdoses. And to support all this work and more, President Biden's 24 budget request includes a 30% increase, or more than $800 million in new money for prevention. Now, we need Congress to pass it, of course. Now, on the other side of the coin, we're working to reduce the supply of these deadly drugs. As you all know, this crisis begins with precursor chemicals from China and ends in America's emergency rooms. Not only are traffickers undermining our laws and harming Americans, but they're the same people who traffic in firearms and humans, and they use their illicit profits to destabilize other countries in order to increase their profits. And that's the common thread. These traffickers are driven solely by profits, and they don't care who they hurt along the way. As you may have seen, we've taken numerous actions against traffickers, including shutting down dark web fentanyl supply chains. And as part of President's State of the Union commitment, we are aggressively working with CBP to build hundreds of new drug detection machines at critical ports of entry. This is going to help us stop deadly fentanyl from coming into our country. And with these machines, we're going to build an already record amounts of fentanyl our law enforcement is seizing at the border and in communities across the country. I saw our CBP agents in action myself when I was down there in Nogales, Arizona, and I saw how the high-tech scanners we're building to catch fentanyl are already supporting our brave officials on the border. And in August, the president officially called on Congress to direct another $800 million towards reducing the supply of illicit drugs like fentanyl and expanding access to addiction care, with $323 million going towards helping us install these scanners more quickly. And I'll tell you, once they're in place, we're going to be able to scan every vehicle that needs to be scanned crossing our border, every single one. So we'll catch more drugs before they reach our communities, And right now we're seizing record amounts of fentanyl, more than 15,000 pounds at the border and more than 26,000 pounds domestically, thanks to you and your counterparts. All told, the HIDA program has denied drug traffickers $22 billion in profits made on the suffering of Americans. 22 billion. And that's something that we should all be proud of. So we're making it more costly for them to harm Americans at every step of the way. The truth is that you and your law enforcement colleagues across the country put your lives on the line every single day so that more Americans don't die from drug poisoning and overdoses. In fact, I was recently on the phone with President Biden, and we talked about how we can better support the work of law enforcement nationwide. And that's why I was so glad to award $302 million to the HIDA program this year and add 9 new counties across 8 different states to make sure that communities that need this support are able to get it. Of course, stopping drug traffickers isn't all you do. You're also working to prevent youth substance use and to be a resource where young people can turn to in times of trouble. The HIDA National Prevention Strategy is working to build and expand efforts nationwide and raise awareness of the dangers of substance use. This is especially important at a time when the drug supply is so lethal. And to achieve these goals and objectives of the prevention strategy, a division for advancing prevention and treatment, or you know them as ADAPT, was developed and funded to ensure that HIDA program is a good steward of HIDA dollars when funding prevention programs, and utilizes a needs-based approach for prevention programming, and finally provide an infrastructure for all HIDAs when funding prevention programs and efforts. So thank you. Thank you to everyone for your work on this. The work you do gives me the time that for our historic efforts in public health to take root. This is really important work. And with all these actions, we're getting results. Let me explain. Overdose flattened in 2022 after sharp increases from 2019 to 2021. And this shows our efforts are working. But still, we cannot stop. We must keep pushing forward. And we need you to keep doing what you do best. Because right now, there are more than 100,000 families counting on you to help keep them safe. What you do can make the difference between life or death, and between a loved one or an empty seat at the dinner table. So thank you for stepping up. And please keep collaborating with your community, whether through your local DFC coalition, your National Guard counter-drug programs, or otherwise, to prevent youth substance use and ensure bright futures and a stronger community. Because at the end of the day, whether you work at federal, state, or local level, I think you all feel the same way I do about public service. We're all doing something much bigger than ourselves. The opioid crisis isn't a red state or a blue state issue. It's America's issue. And working together, we're going to beat it. And as President Biden said, today, we will ensure that young people have the tools they need to thrive. Our children deserve nothing less. Thank you.
Thank you, Dr. Gupta, for those very important remarks. At this time, we are going to be transitioning over to the morning keynote, but a quick update, hot off the press. Zoom has updated its platform, so now you will be able to access all of the resources for each individual session once you log into the session. And I want you to take a look at the bottom of your screen. You will see a resources tab. Once in each session, you can click on that resources button and it should bring you to the individual resource supplements for that session. In addition, in the chat box, we will be adding the links for each of the tools that I mentioned throughout the day. So we'll see you at the next session. Go ahead and close out and join the morning keynote.